Hello and welcome. I'll be speaking to you on why you or somebody you know might have experienced pain in the jaw. So, why does the jaw hurt? Now, firstly, it's important to mention that there is a joint in the jaw. So, what essentially does that mean? It means that wherever you have two bones meeting, usually that will be described as a joint. And so the jaw is somewhere around there, but what we need to realize is that there is actually a joint there. And that joint is made up of the mandible, which is the lower jaw, and then the temporal bone, which is around there. So at the meeting point there, you have a joint. Usually that joint is well aligned such that you're able to chew, talk, yawn. The mouth is able to move in a number of directions without problems. However, for some reasons, which may either be unclear, pain may result. Sometimes it may be also due to excessive strain on the jaw joints and the muscle groups or muscle group. Now, for a condition called bruxism, essentially what that means is grinding of the teeth. If you stay very close to some people, you will possibly hear the sound that is made as they grind the teeth. With such excessive strain on the jaw, joints, and muscle usage, there could be TMJ or temporomandibular joint dysfunction, which is simply another name for the jaw. It could also be a result of trauma. If you had an accident, a punch, or one reason or the other, to that jaw, there could be pain arising. And for patients that have had some form of arthritis, maybe osteoarthritis or rheumatoid arthritis, they may also have jaw pain. It can also occur in patients that have fibromyalgia. Now, for these conditions, osteoarthritis, rheumatoid arthritis, fibromyalgia, I've made videos, and you could actually have a look at those videos at your spare time. What are the symptoms of this condition? Patients that have this condition will present with pain, ear discomfort, headache. They could have limited mouth opening. They could actually have locked jaw called trismus, which is that the facial muscles come into spasm. And so they're essentially unable to open their mouth. They may also present with crackling sound while eating. Most times the diagnosis can be made clinically. However, sometimes it may be necessary to do x-rays to consider the possibility of other conditions causing this problem. I'd like to say that the treatment could be divided into non-pharmacological, which means no use of medication, or pharmacological, which means use of medication. Sometimes some people may actually require surgery. Now, if it is non-pharmacological, we're talking about physiotherapy. So you visit physiotherapists, carry out or teach some form of exercise that you could carry out. Then you could also, by your own self, limit the amount of mouth opening, particularly when you yawn. Could also use a warm compress. You may have to have a change of diet to something that's soft or softer. And then sometimes it may be necessary to have an appliance or a mouth guard that can be worn in the mouth to reduce teeth grinding. Now, if these measures do not work and it's necessary for you to move over to medication, simple analgesics or over-the-counter medications such as paracetamol or non-steroidal anti-inflammatory drugs such as ibuprofen could be used. Sometimes it may also be necessary to administer muscle relaxants. Now, who's the doctor that is responsible for treatment of this condition? It depends again on what is causing the problem. If it is due to teeth grinding, it's necessary to see your dentist. If it is the fact that stress and anxiety are making things worse, it may be necessary to seek appointment with a psychologist. And then, if it's for advice about jaw muscle exercises and massage, it may be necessary to see a physiotherapist. And if the underlying problem is from arthritis such as rheumatoid arthritis, then a rheumatologist will be the doctor to see. And so, number one, patients can have jaw pain, maybe due to conditions such as rheumatological problems or simply behavioral factors such as excessive grinding of the teeth. And for these conditions, most of the time, you could actually resolve spontaneously or use of medications or simple exercises. But if you require seeing a doctor, that will be dependent on the cause of the problem. Thank you for watching and see you again. Bye.